the team here, anybody has any question or want to share with us your experience of drinking this water? Or you have any question want to ask Dr. Prabhu for some medical advice or anything? Just unmute your mic, yeah, to be fast, or you can type in the chat group.
Hi, Doctor. It's been said that the terahertz water is not advisable for people who've got pacemakers. What about the people who had previous heart problems?
Okay, we are talking about pacemakers. Let's be very specific to pacemakers, okay? Now, pacemakers are a situation where they are using a battery, and that's how it just controls your heart to function in a regular manner. So that's how the pacemaker is there inside the body. Now, what is happening is, because of the high energy of this particular water molecule, the company feels that it is always safe to tell people that do not use this water if you have a pacemaker. It's on the safer side. It's just like, you know, you take tablet Panadol. If any of you go buy a product from the pharmacy, it would have clearly mentioned children and pregnant women keep away. Now, what do they mean? Does it mean that a pregnant lady cannot take Panadol? Yes, what they say is, to be on safer side, they want to let know people that tomorrow, if something goes wrong, the company, especially in developed countries, they are very specific. The lawsuits are very, very high there. So in that way, the company wants to play a safe role. But I do have come across people with pacemaker without their knowledge who have been consuming terahertz water. They didn't have any problem. They didn't have any problem. For the reason is they were consuming around 500 ml to 1 liter of water. So it didn't really matter much. I think, Angie, you should be able to give us this a few people who have already used the water with pacemaker, but they didn't have any problem. But
Yes,
as I told, from the company side, they want to play a much more safer role, nothing else. Second, your cardiac conditions. If you're talking about cardiac condition, what kind of cardiac condition are you talking? Are you talking about cardiac with lung problem? Are you talking about cardiac with liver problem, or cardiac with your kidney issues? There are multiple. If you're talking about a simple, maybe you're talking about a block, just a simple block. If you are talking about that particular situation and you're going to consume a terahertz water, very simple. Now, when you're on after a post what you say is your heart attack normal or a block, what the doctors will give you is, if you're not gone for a bypass or even stenting, if your block is just 30 or 35%, they will put you on some blood thinners. Now this is where I would like to share is, if you're on a blood thinner, what is the basic function of a blood thinner is, your blood is acidic and thick, so they give you some medication like aspirin, so it makes your blood a little thinner so that it can flow much more easily. This is the main concept of it. Now when you're drinking terahertz water also can assist you in thinning your blood, not like a drug, but this is a natural process wherein when you drink this water, one of the easiest and way to understand is, when you drink this water and when you take a drop of blood and then when you see in a microscope, your cell hydration is very good, and the way the cells are moving is much higher speed. Now what does it mean is, this particular water's energy is so good and high that the moment you're consuming, on one side you get the benefit of blood thinning, and the other benefits is it gets energized, your cells get energized. But if you're talking about a heart issue with other problems, I definitely would request you need to communicate with the doctor who is already experienced in advising you with terahertz water. And so like a cardiologist should know even the theory of terahertz therapy, or the water, or the science behind this terahertz water molecule, then it becomes easy. But many a times we will notice that it will be difficult for a doctor to spend. For example, you think a cardiologist will have time to go through all this, and then, because his time is so precious that for him to even basically treat patients with his time schedule is so busy. So in that way, It depends on the individuals. I would say if there is an opportunity for us to exchange the information through our probably this group, definitely we would like to. But complicated cases, definitely we cannot give a general statement on a platform like this.
Fair enough. I appreciate it very much. Just one more question, if you don't mind.
Yes.
I'm planning of sharing this terahertz water in areas where there's no filtered water. Okay, so can we still do it?
You can do it. What will happen is the company is providing you with a filtration system where you just fix it in the tap there, and then that filtered system is good enough for you to. You don't have to worry about the external filter, because when you say that the particular area filtration system is a problem, and then you use the company's filtration system is good enough for you to drink that water.
What about
Dries, where are you from?
I'm from Australia, but I'm about to fly to Africa, and the problem is water from wells, but I'm not very clean, so it's going to be a bit hard to adapt the filtered device that the company is providing us. So
You mean there is no tap, no tap over there?
not there's no taps in certain areas, remote areas, where the water is still always been wells, but it's been affected by farming, pesticide, and other things that filtrate through the ground.
So what kind of water do the residents there drink? They buy water?
They drink water that I can't drink. If I drink it, I'm really running to the toilet for the next 2 weeks. So I know.
Then how about the drinking? What kind of water they drink?
The body is adapted to it. But I know for a fact, because as soon as I drink a glass of water, my body is freaking out for the rest of the time. So,
okay.
Here, Angie, let me share something.
Yes.
In Australia, I met one beautiful soul where he has invented a 20-liter jar, and there is a filtration system inside. So what happens when you collect the water inside, it gets filtered, and then you get a filtered water outside from the jar. You can actually, it's an Australian innovation and invention. So especially if you're looking at an Africa or an underdeveloped countries, you should look in for these kind of portable devices wherein you can actually, pour in the water, and then, at least we need to, as you say, I totally agree with you that the people drinking that water, they are used to it. The body is used to it. But at the end of the day, you would be noticing that when they are all reaching the age of 50 years or 60 years, they will start facing diseases and they will start facing problems. And the government will have to look into the disease part of it. The hospitals, the spending on medication will be there. So it's a beautiful system. I think we all need to work on people to get at least potable drinking water. We need to help in whatever little ways we can, and then move forward.
Thank you very much. Appreciate your time.
Okay. Yeah. In fact, Dries, whatever drinking water, for example, you go back to Africa, for sure, I think you will buy the mineral water or anything, the bottled water to drink, right? So this bottled water, you can resonate with 3 minutes, then you drink, that you become single molecule and antioxidant, anti-radiation, all the characteristic, you will get it. Yeah. So it can be any kind of water, drinking water, you just resonate 3 minutes. Is it clear?
Yes, thank you very much. Thank you.
Okay.
And can you have to just put it on top of water? Do you have to remove the cap, or like if it's in small bottles, or what's the capacity we can resonate with that unit? What's
the resonation maximum is 3.5 liters is the standard company operating procedure. That's why they give you a jug wherein you need to terahertz 3.5 liters. But what is happening is, especially if you're going to, in a mass production of 10 bottles for a particular person, that is where we have made our life more easy by using the device on a 5-liter jar directly. But you should at least do it 2 times if at all you are using a 5-liter jar. But above that, I don't normally recommend, because especially people coming with 10 liters, the resonating power may not be the same. But the ideal, the best is 3.5 liters in the jug. What our company has given is the best. You do once is good enough. The efficacy is fantastic.
And remove the lid, correct? Or can it go through the lid? Do you need to remove the lid of the bottle, or can
Of
it?
course, without the, if you have to open it up and then they expose the water, because the radiation has to penetrate the water. You have to.
Exactly, it can't go through the plastic or anything like that.
No.
Yeah.
There is some secret I want to share you is the jug what the company has manufactured is a unbreakable FDA approved. Now it is a silicon infused jug. Now the most beautiful part is you are using our device and resonating. The whole chamber is so beautiful that the resonation is perfect for 3 minutes, and the terahertz technology what the company has brought down, and then the penetration into the water molecule is just fantastic. But if you're looking at using a 5-liter can, the plastic what they use, we do not know what quality is it. So in that way, definitely there is some reason behind the company came out with this particular jar. So it's good that we all practice terahertzing in the device, our jug, and then transferring it into other bottle would be ideal and would be good for you.
Thank you so much. You brought so much knowledge and clarification. Really appreciate your time and clarification. Thank you, sir.
I think there was one question here. Person has been drinking water and then suddenly creatinine level increased, started with 125 ml. So I would like to answer this particular question, especially creatinine level. Okay. Now the first question I want to ask would be is your creatinine level. So are you a patient of early kidney failure? Are you a patient of early kidney failure? That's number one. Number two, if you're talking about creatinine level, what was the kidneys creatinine level before and what is the level now? That is the second question. Number three is for your creatinine level to increase, it is not just the water alone is a factor to affect your kidney functioning. Because kidney function by itself, if you are looking at, as I always tell, the toxins inside your body is so high. That is why you go into a kidney issues. That's why your body is not able to throw it out. For example, if you have cadmium toxicity, your liver will remove it and then send it to the kidneys. The kidney has to filter it and throw it out. Now what happens, kidney, the filtration system, your cadmium will go and block the filtration system. Once it gets blocked, you have 2 million nephrons, the filtration system. If, for example, 100,000 filters are blocked, what will happen? Your creatinine level will slowly rise up. Now, do you think that it is because of the water you're drinking, then your filtration system becomes a problem? I don't think so. The situation is because this water is so beautiful that it can pass through anywhere and come out, right? Now, we need to look at other factors. There are so many factors we need to look at. If you are looking at one particular problem, it could be a kidney, it could be your lungs, it could be your diabetes, it could be a liver problem or intestine problem. It should be from a broader perspective. So if at all you need to discuss on this, I would prefer get in touch with me. Let me see how I can assist you on this particular area. And then definitely you should be able to come out of this problem, because many times your kidney needs proper nutrition for it to recoup back. There are a lot of kidney cases I'm handling, and then we are able to help them to recoup back. Because the first thing we need to do is your kidney cleansing has to be proper. That means proper drinking water. There are a lot of things I can guide you. So please do call me and then I will be able to assist you. And there is another question from alkaline water system can be used. I have been repeatedly telling you can use alkaline water. Only thing is you need to see is your body acidic or alkaline, number one. Number two, if at all you're going to use alkaline, what is the pH you're going to use? Are you going to use 8.5, 9 or 9.5 pH? Are you going to check the pH every time? We do not know. Normally we don't do. We just believe the digital number which comes in that particular instrument. Unless you bought a very expensive instrument, yes, definitely that quality will be perfect to the whatever pH they are mentioning. But for you, if at all you want to go for a higher pH, you should justify why you want to go for a higher pH of water. Why do you need to give a drink a high pH of water? If you justify, then I don't mind saying, okay, fine, go ahead and drink. But ideally, our body needs 7.5 to 8.5 pH is good enough. And I found that even if you terahertz 9.5 pH of water, I have tried all the experiments. It is the same. It may be 9.5 to 9.6. It may change a little bit, but nothing much is changed. But the choice is yours, what you want to do with the, especially the alkalinity of water. You decide. But for our body, 8.8 maximum 8.5 is good enough. Dennis, what is he asking? Is there a water? Okay, can we make a water into ice and then, hey, this is something very beautiful I want to share. The terahertz technology, if you terahertz water and then put it in the ice, and you can take it after 2-3 years and then you know defrost the water and you drink it, the terahertz, whatever the molecular structure, it's still the same, you know, something very beautiful because it's more stable. So drinking ice water sometime, as you requested, Rosie, then you can drink, but have a balance on what you're drinking. Okay, does a person have to stop aspirin while taking terahertz water? Okay, now here the answer I would give is, I cannot openly tell you please stop aspirin because you're not my patient, number one. Number two, I have not seen you. What are the other areas where you have problems? Is it just you're taking aspirin only for dilution of your thinning of blood, or are you for a particular disease the doctor has put you? So in that way, definitely, if, for example, you know, your body is very acidic and your blood pressure is slightly high and you go to the doctor and you just say, okay, start taking aspirin, and that in turn can thin your blood and then it can help you to have a good circulation, then I would say replace it with terahertz water. That means drink terahertz water for a period of 2 to 3 weeks slowly and then take out the aspirin. But if you are being given aspirin for a cardiac problem or for a heart attack problem, I would say we need to work on you and then assist you so that you should be able to remove it slowly. You can do it. Definitely we can do it. But there are other factors we need to look at. How do we assist you? And is it just thinning of blood? Your thinning of blood is only the criteria we are looking. We are looking at different factors. So in that way, you need to look into what is the reason you have been on this particular aspirin tablet. Can the patient take this? Yes, definitely you should consume the water. What will happen is the water, when you're consuming it, and the cellular hydration, when there is a proper cellular energy is available, and then outside you're giving a radiation therapy for this particular patient. Now, what will happen? Your cells are healthy. So what will happen? This radiation, no doubt there is some kind of effect on it, but our main aim of radiation is killing the cancer cell. That's our aim as a doctor. But what will happen is when you're doing the radiation, definitely there are normal cells also would be killed. But when you give an opportunity for your body to have the right hydration, nutrition, and the energy, the cell division will be fantastic, and then automatically it will recoup. That means whatever after post radiation, whatever problems you may be facing can be balanced by this particular healthy cells to multiply and move forward. Let me answer my phone call, please.
Okay, so while doctor answering the phone call, maybe I share with you something. Just now, I think Dries asked about what is this product, right? Yeah, I show you some pictures. So you can see my pictures. Okay, so this is the filter that is given out on the bottom left. The filter is a very simple filter. You can tap to the tap, and the device is on top. You see, it never touch your water. And the jug is given is the FDA proven plastic. So it's a good quality plastic. Yes, you're back.
There's a patient already waiting in the clinic.
Okay.
Thank you very much. Have a wonderful
Dr.
evening
Prabhu.
to everybody down there, and then I look forward to see you all next week.
Okay, thank you. See you.